Ideally, this rotator cuff tear happens basically because of trauma. This is a much more serious condition, and especially this is more common in elderly people. To understand this better, I'd like to give you another analogy where you have seen a pulley in a well. So the treatment of rotator cuff tears is basically a keyhole procedure. Namaskar. Welcome to Vitadell. I am Dr. Gopinath Duraiswamy, clinical lead and senior consultant orthopaedic surgeon. I'm a surgeon who specializes in complex trauma, arthroscopic and sports medicine, joint preservation, and joint replacement surgeries. Today, we'll be talking about rotator cuff tear. Now, this is a much more serious condition, and especially this is more common in elderly people. We've seen many elderly people in our homes finding difficulty in lifting their shoulder, doing their activities of daily living. Gradually, the functionality of their shoulder comes down because they feel extensive pain and also difficulty in lifting overhead. This is basically because of the rotator cuff tear. To understand this better, I'd like to give you another analogy where you have seen a pulley in a well, right? In older days, we used to row water with a pulley and a bucket. Imagine this upper half of the arm is the bucket, and this is the rope which pulls the bucket, and this curvature is the pulley. Only when you are able to pull the rope through the pulley, the bucket will come out. For some instances, over due course of time, when the rope which is tied to the bucket is torn, the bucket falls down inside the well, and there's no other way to bring the bucket outside the well. Similarly, when this particular muscle or tendon tears off from this junction, that is from the attachment point to this bone tears off, this bone will fail to come up. So the patient with this particular pathology will not be able to lift the arm above. This is the basic pathology of the rotator cuff tear. Ideally, this rotator cuff tear happens basically because of trauma and rarely because of age-old degeneration of this particular tendon. So rotator cuffs are nothing but they are pulley mechanism where they try to pull the arm above. Detachment from the bone will leave the bone unassisted, and the bone will not be able to lift it off above the shoulder. So the treatment of rotator cuff tears is basically a keyhole procedure where we just have to take a small camera inside the shoulder joint and localize the area of tear. Once we find the area of tear, all we have to do is trim the edges, freshen up the bone, and deploy a small 4.5 mm anchor in the bone and take a bite in the torn edges of the tendon and reattach it to the original point or the footprint of the rotator cuff. Once we do this, the cuff is reattached to the bone, or similar analogy, the rope is reattached to the bucket. Now the muscle will regain its power, and once the tendon heals to the bone, the arm can be lifted up and regain the mobility. Similarly, how the bucket comes out from the well. Thank you.